Hello and welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan, and today I will be talking about a qualitative study which basically aimed to explore the various difficulties that was faced by junior residents, auxiliary nurses, and even midwives and medical social workers during the home visits of palliative care patients, and also to address these difficulties in their future visits. Now, the study that I'm talking about was conducted in peripheral institutions where palliative care is actually provided to the patients, which helped to identify the difficulties that was faced by healthcare providers and also to plan for solutions in future palliative home care visits. Now, the study is published in the Indian Journal of Palliative Care, which is published by Scientific Scholar. So, to talk to us in detail about this study, we have with us today the lead authors, Dr. Priyanga and Dr. Rajalakshmi from the Department of Community Medicine, Sri Manakula Vinayagar Medical College and Hospital from Puducherry. Welcome to Medical Dialogues, ma'am. It's really a pleasure to have both of you online here with us today.
Thank you, ma'am, for inviting us for the digital interview. And we are happy that our article has been selected for the interview.
Thank you for inviting, ma'am.
Great. So now if you could just give us a brief about what is the state of palliative care in the country and how has the field of expertise evolved in the past decade. If you could just give us a brief about that.
Ma'am, actually from when compared to the past, the palliative care has gradually increased more than that of before. That to house survey, the number of people that are visited nowadays have increased when compared to that of the past, and that too it is 0.74% according to the NFHS 5 data. That is, these houses were visited. When compared to previous NFHS data, it has increased more.
Previously, we don't have the list of palliative care patients, but now slowly the list was generated, and all the list of palliative care patients in all the areas were taken care by the nearby medical colleges. So our job is to identify the palliative care patients nearby, so in our service area of our college, and we go to them and we provide our service. So that's how we have slowly identified, and there are more palliative care patients in need nowadays.
Great. Definitely, palliative care is evolving over the period of time, the future, if I take that into consideration. So now, if I talk about that in a little bit of detail, what are the major challenges that healthcare providers actually face in offering palliative care, especially when I talk about home visits?
The challenges that our junior residents, or maybe it is the medical social worker or the ANMs, that they face is the lack of resource, time constraint, and also there is a need for specialist care, ma'am. These are the major points which we have stressed in our article too.
Okay, that is noted. Now, if I talk about it in a little bit detail, now what are the techniques that are involved in your study, and what are your plans on developing such a study on a much larger and a larger scale and even a larger database?
Ma'am, the technique that we used it is the PRA technique, and why we chose this PRA technique is that the participants, they will be able to give the opinion on their own words, so that we will be able to grasp better than that of other techniques. So mainly we have used three techniques, that is cobweb and pairwise ranking, and also force field analysis. These are the three techniques that we have used, and yes, we can use it for a larger scale. How we can use it for a larger scale means, if we are able to enlist the number of patients, means we will be able to do it in a larger scale, and that too we will be doing it as a mixed method study. So we will be involving a quantitative part also, ma'am.
So yes, ma'am, as Dr. Priyanka said, so since we have done in our service area, so we were able to do only, we were asked to explore the challenges. So we were in a position to explore the challenges faced by the healthcare providers. But when we plan the study in a large scale, so we can do it as a mixed method research. So that is involving both quantitative, that is the list of line listing of all the palliative care patients, what are their problems or challenges faced, and we can also give a solution for that. Yes, definitely it can be done in a large scale basis.
So, if you could just explain to us what is the state of approach of the family members of the patients who are actually receiving the palliative treatment, and how do you think can the healthcare providers also work in unison with them for the better outcome of the care that can be provided to such patients?
Ma'am, for palliative care, in around the palliative care patients that whom we are seeing around our centers, they are really satisfied, because for reaching any primary care means they have to go for around 15 to 20 kilometers. But we are giving care for those kind of people also, who are from around 10 to 12 kilometers from our center. So the family members as well as the patient are more satisfied with our service. And for a better care, what we can do is that we can counsel the patient's family members, so that they will give an emotional support for the patient, and also they will give some dietary support, and also they will encourage the patient to take, in case of any medication, if they have to take means, they will encourage the patient to take any medications. And also they will see to that the patient are adhering to the advices what we say. So the adherence to the advices, follow up and adherence to the advices what we say will also be increased if we counsel the family members also.
Yes, ma'am. We are doing this counseling regularly as a part of our community-based palliative care program. Yeah, in that program, we send our ANM, medical social worker, and also staff nurse along with the resident of a resident. So they used to go there and they do a regular counseling of family members, and they find out the needs of the patient. It was well received by the family members. All the care which we provide to them are well received since it was provided at their doorstep. So it was all community-based palliative care program is running successfully in our center.
So, lastly, if you could both just tell us your experience about how has it been with publishing with IJPC, and how has this journal actually contributed to this sensitive clinical field over the years?
Under scientific scholars, Indian Journal of Palliative Care, and it was very user friendly. And also we were able to explore more regarding palliative care through this journal. And also we have also cited many articles from this journal in our reference, ma'am.
And in the past few years, we have also published community-based palliative care articles in this Indian Journal of Palliative Care. It's very user-friendly actually. So all the editors and they come to contact with us every 24 hours during our galley proof time, and they're very easily approachable. Thank you very much for the journal and also for the platform of scientific scholar.
Great, great. So thank you so much, Dr. Priyanga and Dr. Rajalakshmi, for joining us today at Medical Dialogues. It was lovely to be gaining your insights about how palliative care has to improve in the future, and it is definitely a must-need speciality that one has to take into account. So thank you so much for joining us at Medical Dialogues today.
Thank you, ma'am, for giving a wonderful opportunity to let out our thoughts regarding the palliative care, and also to share about the experience that we faced during the palliative care of palliative care for patients. Thank you, ma'am.
Thank you very much, ma'am, and also thank Scientific Scholar for giving us the opportunity. This was our first time to share our views in online digital platform. It was nice talking to you, ma'am. Thank you very much.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.